We now turn you to the coronavirus in Connecticut. New numbers from our governor's office show the state's positivity rate is at 6.67%. There have also been 27 more deaths in the past 24 hours, and hospitalizations are up by 16. St. Francis Hospital is expected to receive its first shipment of Moderna's COVID-19 vaccine today now, after it was delayed a day. And this comes as the CDC just changed the guidance on who should get the shot first. Channel 3 Eyewitness News reporter Caitlin Nuclo is live right outside St. Francis with the latest. A lot of people watching this morning wondering if they're affected by this change, Kate.
Sure, and a lot of people waiting to get that vaccine, anxiously waiting to find out when it's going to be available for them. Thousands of healthcare workers here in Connecticut have already been vaccinated, including many here at St. Francis Hospital. But those who are in that age range of 65 to 74, well, it looks like they're going to have to wait a little bit longer. The change was recently made by the CDC. Those between the ages of 65 and 74 with high-risk medical conditions were originally slated to get the vaccine at the end of January, and now may not be able to get the vaccine for another 4 or 5 months. The first doses of the Moderna vaccine will be given to Hartford healthcare workers on the front lines as part of Phase 1A. For Phase 1B, this is who's up next: first responders, teachers, childcare workers, food and agricultural employees, correctional staff, public transit, postal workers, grocery store staff, manufacturing workers, and those 75 or older. Those between 65 and 74 are now in Phase 1C.
I can tell you that I lean towards following the guidance of the CDC. We have our own advisory group made up of an incredibly diverse group of folks who know what they're doing, help me advise on that. Look, and there's some thinking you've got. Essential workers on the front line, you want them to be able to take care of work and be able to do that safely. Folks, as you pointed out, either older, much older, 75, or pre-existing conditions that are most at risk. We're doing everything we can to keep them alive, and hopefully they don't suffer complications that would congest our hospitals. So I think so far the CDC guidance makes some sense to me.
So the governor says everyone in that first group, Phase 1A, should be vaccinated, it looks like now at least, by the end of January. We are live in Hartford. Caitlin Nuclo, Channel 3 Eyewitness News.